Please, Marcella.
Hi everyone, my name is Marcella Williemsen and I'm a PhD student at the Amsterdam UMC. Today I would like to present a study on immunophenotypic analysis in blood of patients with segmental and non-segmental vitiligo. Based on morphology and activity, vitiligo can be classified into segmental and non-segmental vitiligo. Non-segmental vitiligo is characterized by symmetrical depigmentation of the skin, whereas segmental vitiligo often occurs unilateral on the body. Moreover, segmental vitiligo often occurs during childhood and stabilizes quickly after an initial period of activity, whereas non-segmental vitiligo patients often experience active disease with new lesions occurring during life. This suggests various pathogenic mechanisms involved, and thus the aim of this study was to identify differences in immune cells in the blood of patients with segmental and non-segmental vitiligo, to decipher what determines if depigmentation stays localized or spreads throughout the body. For this, we collected peripheral blood samples of patients with segmental and non-segmental vitiligo. Next to that, we also collected healthy donor blood to decipher what is really disease-specific. After isolating the blood cells, we analyzed these by flow cytometry to determine the percentages and phenotype of different immune cells. Regulatory T cells are a subpopulation of T cells that regulate immune responses, but also create tolerance to self-antigens and prevent autoimmune diseases. So, considering this last bullet point, we wondered what the role of these cells in vitiligo is. We found that circulating Tregs were significantly decreased in patients with non-segmental vitiligo compared to segmental vitiligo and healthy donors. As this might be influenced by autoimmune comorbidities, we corrected for this. And we found that patients with non-segmental vitiligo that also had autoimmune comorbidities had significantly lower levels of regulatory T cells compared to those non-segmental vitiligo patients that did not have any autoimmune comorbidities. This indicates that Tregs are decreased in patients with comorbidities and that these are unaffected in patients with segmental vitiligo, which is also consistent with less comorbidities in segmental vitiligo. Next, we wondered whether circulating antibody responses were different between non-segmental and segmental vitiligo patients, as these have been reported for non-segmental vitiligo but remain incompletely studied in segmental vitiligo. We found that antibodies against the selected melanocyte antigens were present in the circulation of a significant proportion of the non-segmental vitiligo patients. 8 out of 22 patients were found to have an anti-melanocyte response. Moreover, 3 out of 8 patients even had an antibody response against multiple of these melanocyte antigens. Contrary, none of the segmental vitiligo patients showed an antibody response, indicating that the presence of a humoral immune response is limited to patients with NSV only. We subsequently analyzed whether the absence of an antibody response in segmental vitiligo is also reflected in less B cell activation and thus less plasma cell differentiation. The presence of total B cells were comparable between healthy donors and both vitiligo cohorts, which was similar for naive B cells, unswitched memory B cells, and switched memory B cells. However, plasmablasts were significantly decreased in blood of patients with segmental vitiligo compared to healthy donor blood. Also, there was a trend observed that segmental vitiligo patients had significantly lower level of plasma cells compared to the non-segmental vitiligo patients, suggesting that patients with segmental vitiligo have fewer circulating antibody-producing cells. To verify whether this reduced plasma-based differentiation was due to reduced germinal center help, we analyzed the presence of T follicular helper cells. These cells normally drive a B cell response to differentiate into antibody-producing plasma cells. Absence of an anti-melanocyte antibody response and decreased plasmablast numbers might be reflected in reduced T follicular helper cell help. Levels of circulating T follicular helper cells were unaffected in patients with non-segmental vitiligo, but were significantly higher in patients with segmental vitiligo. Also, segmental vitiligo patients had increased numbers of T follicular helper cells with an active phenotype compared to those with non-segmental vitiligo and healthy controls. On the basis of the expression of CXCR3 and CCR6, we can decipher different phenotypes of T follicular helper cells. And these provide difference. These cells differ in their ability to provide B cell help to naive or memory B cells. T follicular helper 2 and 17 cells were significantly increased in segmental vitiligo compared to non-segmental vitiligo and healthy controls. However, these patients did not show more active T follicular helper 2 and 17 cells. Because we think that the provision of B cell help is limited to activated T follicular helper cells only, and these did not differ between the cohorts, it seems that both vitiligo cohorts show no normal germinal center help that is not different from the healthy controls. Altogether, this study provides important insights into the differences in pathogenesis between segmental and non-segmental vitiligo. In contrast to non-segmental vitiligo, segmental vitiligo patients do not involve systemic immune activation, indicating that this pathogenesis is associated with a localized cytotoxic reaction targeting the epidermal melanocytes. If you're interested in reading more about this study, you can find a paper published in the Journal of Investigative Dermatology in June this year. With this, I would like to thank all the people involved, especially my promoter, Rosalie Luiten, and my co-promoter, Marcella Beckheim. Also, Helen Kemp for analyzing the serum samples, and all the patients that, of course, donated blood for this study. Finally, I would like to thank KWF and Pigment Fonds for their financial support. Thanks for your attention. If there's any questions, I would be happy to answer.
Thank you very much, Marcella, for this interesting presentation, this quite complete evaluation, or certainly a wide type of evaluation of the immune status in patients with segmental, non-segmental vitiligo is certainly interesting. That has underlined several differences in the immunological basis. Is there any question? Do you follow the patients during the time? Did you check if some differences in the level of Treg, for example, in patients with non-segmental vitiligo, were different if the patients were in active form or in stable form, or yes, if the therapy could modify the immunological status that we're capable to detect?
No, for this study, we only collected stable vitiligo patients because those were more comparable to the segmental vitiligo patients. And we also look at other patient characteristics, but there wasn't a difference between those. So it was specifically the autoimmune comorbidities that could affect the regulatory T cell levels, but none of the other clinical markers.
Yeah. And the segmental cases, were they stable?
Sorry? The segmental were all stable, yes. Yeah. Yeah, we had some ethical issues with collecting material from children, and so all of these patients were at least stable for a year. So yes, definitely stable.
Thank you. Thank you.
You have underlined again about the presence of autoantibodies in non-segmental vitiligo. That is topics that recently was not so underlined, the possible role of autoantibodies in the spreading manifestation of non-segmental vitiligo. What's your idea about the role of antibodies towards the cellular immunity in non-segmental vitiligo?
Yeah, I'm not completely sure because you don't really see more B cell activation or anything else. I'm not completely sure what this will really affect the pathogenesis in these patients. So that's, I think, still to be determined, but it's really interesting that at least the humoral response is only happening in these non-segmental patients. Yeah.
Any other question? So, if not the case, I would like to thank you for your presentation.
Thank you.
And we will move to